Health professionals maintain health in humans through the application of the principles and procedures of medicine and caring. Health professionals study, diagnose, treat, and prevent human illness, injury, and other physical and mental impairments. They advise on or apply preventive and curative measures and promote health with the ultimate goal of meeting the health needs and expectations of individuals and populations. They include medical doctors, nursing professionals, midwifery professionals, dentists, and pharmacists. But why focus on training of these healthcare professionals in conflict zones? Currently, there are over 25 armed conflicts in the world, some of which have been ongoing since the early 1990s. Conflict-affected zones are home to more than 1/6 of the world's population. 2 billion people live in countries where the development outcomes are impacted by conditions of fragility, conflict, and violence, and the majority of which are in developing countries. Populations who are victims of conflicts are the most vulnerable in terms of health and medical needs. Those who are enduring conflict are often deprived of essential health services and resources. Health systems may be partially or fully devastated by the conflict, lacking human resources, health infrastructures, and other necessary resources. More than a third of maternal deaths worldwide occur in such zones. Half of the children who die before age 5 live here. They receive around 40% less aid than predicted due to lack of training of healthcare professionals. Conflict-affected health systems have to deal with increased levels of conditions associated with violence, infectious disease outbreaks that follow population disruption, of which Ebola may be an extreme example, and mental health problems that follow from the stress and dislocation associated with conflict. Supporting fragile and conflict-affected states is a priority for the World Bank Group and the international community. They experience repeated disruptions in their development progress, resulting in low growth, high level of extreme poverty, and lack of access to basic services, especially for the poor. In addition to this, they are unable to cope with political, security, economic, and environmental stresses. The persistent nature of fragility and repeated cycles of conflict have led the international community to focus its attention on the challenge of inadequate training. Let us look at how Bhutan, a conflict-affected zone, has attempted to tackle the issue at hand. The priority was to recruit more doctors because around 1/3 of district hospitals had only one doctor. Doctors had to assume senior positions such as district medical officers in spite of having relatively little experience. With no medical school in the country, Bhutan sends 15 students each year for training to India or elsewhere. Between 1998 and 2003, the number of doctors, national and non-national, increased from 98 to 140. A recent attempt at improving healthcare training is the development of a distance learning nursing degree program offered by the Royal Institute for Health Sciences. This is expected to greatly improve the skills and quality of nursing care in the country. Another priority was to increase the number of female health workers who make up about 50% of health workers. More women are needed as health workers to improve standards of maternal health. Often one of the first NGOs on the ground, WAHA, Women in Health Alliance International, conducts rapid initial needs assessments to identify the population urgent needs and to define the appropriate interventions. WAHA strives to set up temporary, fixed, or mobile health facilities to offer medical care to the local and displaced populations in accordance with need diversities and changing contexts. Additionally, WAHA provides medical support to local health facilities and collaborates with local and international partners by providing highly skilled doctors, nurses, psychologists, and other specialists. In conclusion, lack of knowledge and skills among clinicians and managers is a significant barrier to improving healthcare. Training health professionals in quality improvement has the potential to impact positively on attitudes, knowledge, and behaviors.
وعينوني عطوني دواء الحمد لله طبت وأنا مبسوطة هلا كتير. أنا عند جيت لهون الأطباء عاملوني بلطف وحبيتهم، وأنا قررت أصير عند الأكبر أصير دكتورة وأعالج كل الأطفال الموجوعين والمصابين.